Hi, we'll continue some of the questions regarding which is asked in the DHA Prometric exam for the Ayurveda practitioners. We'll continue the question discussion. So the next question was related with the extracellular fluid. Okay, so we know that in our body waters are there. So total body water, okay, which is a combination of intracellular fluid and extracellular fluid. Okay, so the body water which contains in our body, it is a combination of intracellular fluid and extracellular fluid. Intracellular fluid means the fluid which is present inside the tissue. Okay, inside the cell, the fluid which is present, that is intracellular fluid, and the fluid which is present outside the cell, that is extracellular fluid. Okay, intracellular fluid and extracellular fluid both are separated by a cell membrane. And extracellular fluid, again it is divided into two types, interstitial fluid and plasma. And both these are separated by capillary walls. Okay, so this capillary walls, there are minute pores are there. Through that way, electrodes, this electrons, ion, all those things will be transferring. Okay, but the proteins which is present in the plasma, which is bigger in size, so because of that what happened, it will not transfer to the interstitial fluid. So you will be getting proteins only in the plasma. Okay, so extracellular fluid, so the fluid which is present outside the cell, if it is increasing in the body, that is called as hypervolemia. If it is decreasing, it results in the hypovolemia. Okay, less volume of extracellular fluid, that will be creating hypovolemia. Increased extracellular fluid will be creating hypervolemia. Okay, so in this question, extracellular fluid, it will be showing increased skin turgor, apathy, decreased temperature. This like options they have given. So in the increased extracellular fluid means the hypervolemia case. So hypervolemia, high volume of blood will be there. There is too much of blood is there in the blood vessel. Okay, so what are the reasons for getting hypervolemia? Okay, heart failure, kidney dysfunction, cirrhosis, and increased sodium intake. These are the reasons for getting excessive volume of blood in the body. Okay, so it is also known as overhydrated or fluid volume is excess. Okay, so there is too much of blood is there in the blood vessel. Okay, too much volume is there. So because of that, what happened? There will be jugular vein distension, increased heart rate, and it is too much of blood is there. So you will be getting bounding type of pulse. Okay, increased BP because more volume of blood is there, so you will be getting more tension in the blood vessel, so there will be more BP. And increased weight gain because of excessive fluid content, increased cerebral venous pressure, increased edema because of the too much of fluid is there, it results in the edema. Increased volume of blood is there, so that result in the polyuria. Okay, and because of the too much of this, because of cardiac failure, you are getting this increased volume of blood. Okay, so too much of fluid is getting in the blood, and this heart failure, what happened, the heart will not be functioning properly, so there will be backflow of the blood will be happening. So because of the too much of blood will get stagnated in the lungs, so it will create wet lungs, so you will be getting crackles, dyspnea while auscultating, you can get the crackles or dyspnea sound. Okay, so more volume of blood, so more this symptoms you will be getting, like jugular vein distension. In the heart, you will be getting bounding type of pulse, edema, polyuria, which means overhydrated. Okay, increased skin turgor you can see in the case of hypervolemia. Okay, so there is too much of fluid is there. Then what happened? Whatever the electrolytes which is present, that will be very less in content, because too much of volume is blood, too much liquid is there. So the concentration will be very less. So that's why in the blood checkup you will be getting in the decreased hematocrit, decreased serum sodium, in the urine decreased urine specific gravity, and decreased blood urea nitrogen. Okay, so these are the clinical features of the hypervolemia. In hypovolemia, less volume of blood is there, there is less blood is there. Okay, so what happened, it is also known as dehydration. Okay, that is fluid content is very less, and fluid volume deficit, hypovolemic shock, these are the synonyms of the hypovolemia. Okay, so in these cases there is less volume of blood, so you will be getting flat neck vein. Okay, you are getting increased heart rate, but the heart rate will be very weak and thready type of heart rate you will be getting. Okay, because fluid content is very less, so you will be getting weak and thready heart rate, increased respiration, increased urine specific gravity. Why? Because the fluid content is very less, so electrolytes will be too much, the concentration will be too much, so you will be getting increased urine specific gravity. And there is less volume of fluid, so you will be getting less pressure, so you will be getting decreased blood pressure, decreased CVP, decreased weight, decreased skin turgor. Okay, dehydration symptoms, you will be getting decreased urine output because fluid is very less, so you will be getting decreased urine output, dry mucous membrane, thirst. So this type of symptoms you can see in the hypovolemia. So in the blood checkup, less fluid will be there, so that concentration of the electrolytes will be more, so you will be getting increased urine specific gravity, increased hematocrit, increased serum sodium, increased blood urea nitrogen. And those are having hypovolemia, so they will be getting postural hypotension. Postural hypotension means it's the same as orthostatic hypotension. So you can get orthostatic hypotension or postural hypotension in hypovolemia. Okay, so in this answer will be increased skin turgor. Okay, so because of the increased extracellular fluid, you will be getting this hydration, all those things will be in a good condition, so you will be getting increased skin turgor. Next one is poikiloderma. Poikiloderma, it is a skin condition. Okay, it is a non-cancerous skin condition. In this skin condition, you can see in the picture there is a reddish brown spots are happening in the neck area. Okay, neck, and it used to happen in the cheek also. Okay, neck and cheek area, these are the two locations you can find the reddish brown spot. And the main reason for getting this condition is long-term sun damage. Long-term sun damage, this is the one of the most common reason for getting poikiloderma. Okay, so poikiloderma, it is a reddish spots which is appearing in the neck and cheek area. Okay, happening because of the long-term sun damage, and it is a non-cancerous condition. Okay, so what are the features? Reticulated hypo and hyperpigmentation, wrinkling due to epidermal atrophy, telangiectasia. These all three skin condition. These are the three features of that skin lesion. So these three lesions you can see in the for identifying the poikiloderma. Okay, reticulated hypo and hyperpigmentation, wrinkling due to epidermal atrophy, telangiectasia. These are the three characteristic features of the skin lesions. Okay, so this is called as poikiloderma, and this this skin lesions you can see in the conditions like dermatomyositis, cutaneous T-cell lymphoma, xeroderma pigmentosum. In these skin condition, you can see this skin lesion, poikiloderma. Especially this condition used to affect in the females. Females, those who have got menopause. Okay, so for them they used to get this poikiloderma usually. Next one, the question related schizophrenia they have asked. So in the schizophrenia means it is a combination of hallucination and delusion. Both the things you can see in the schizophrenia. Okay, visual hallucination is also there, auditory hallucination is also there, delusion is there. Okay, and because of this, what happened? The patient's work-related things, personal relationship, all those things will become breakup. Okay, because of the hallucination and delusion, and because of the disordered thinking. Okay, the patient will not be able to do the work office related things, and the maintaining the relationship between the friends, relatives, all those things, it will become disturbed. Okay, and along with this they will be having some negative symptoms. Okay, negative symptoms means they will not self care, that hygiene, all those things they don't have. Okay, they don't do any sort of self care, and they always feeling afraid about other people. Okay, so they will be speaking very little, and they will be having depression, anxiety. Okay, and sometimes some people they will be getting suicidal thought also. Okay, so these are the clinical features of the schizophrenia. With the treatment we can recover the schizophrenia. Okay, most of the patients can with the treatment like CBT, okay, cognitive behavioral therapy, or with the some of the antipsychotic drugs, with that schizophrenia is completely curable. Next question was regarding with the investigation which is doing in the rickets. Okay, so rickets we know it is a vitamin D deficiency disorder. So what are the investigations to be done for identifying the rickets? So the first one is serum ALP levels are raised. ALP means alkaline phosphatase. Okay, it is an enzyme which is mainly produced by the liver and bone. Okay, ALP, alkaline phosphatase, it is an enzyme which is released by the bone and liver. So whenever you have got a liver disorder, whenever you have got a bone disorder, increased ALP you can see in the blood. And it is a vitamin D deficiency, you have to check the measurement of serum 25 OHD, vitamin D. Then parathyroid hormone also you have to check it, that will be elevated. Okay, parathyroid hormone will be elevated, and serum phosphate will be low, serum calcium will be in a normal, and you have to do the bone biopsy, then X-ray. So in the X-ray you can see osteopenia. Okay, there is less calcium will be there, because vitamin D is essential for the calcium absorption from the GIT. Okay, so this vitamin D is not happening properly. So what happened? Calcium absorption will not be happening. So it result in the bone density reduces. So you can see the changes of the bone density in the X-ray, osteopenia, and because of the osteopenia it can create vertebral fracture. So that also you can see. If it is much more advanced cases, then you can see some of the focal radiolucent areas, which means too much of this osteodensity. Okay, the bone density has become too much reduced, so you can see clearly in the X-ray radiolucent area. So that is also known as pseudo fractures or Looser's zone. This is usually seen in the rib, pelvis and long bones. So these are the investigations to be done in the rickets condition. So according to the options, whatever it is given, accordingly you have to choose the answer. So these are the main investigations to be done to identify in the rickets. Next question was painful constipation. It is a major complaint in which of the following conditions? Okay, painful constipation. Severe pain is there because of the hard stool. Okay, so in which condition you can see? So the options they have given is acute intermittent porphyria, hypothyroidism, hypoparathyroidism, and all of the above. In hypoparathyroidism, you can get constipation, but it is not a painful constipation. Okay, it is not a painful, it's a normal constipation you will be getting. You don't get any sort of disturbance with that. In acute intermittent porphyria you will be getting painful constipation. So among these four options, acute intermittent porphyria is the answer for getting painful constipation. So acute intermittent porphyria, it is a type of porphyria. Okay, porphyria means it is a group of disorders. Okay, group of disorders in which porphyrin it is getting built up in the body. Okay, porphyrin is getting built up in the body. Because of that, you can get different type of disorders that all togetherly called as porphyria. Porphyrin means it is an abnormal organic compound. Abnormal organic compound, this is getting deposited in the body, and because of that you can get different type of disorders. Okay, so that all disorders are collectively called as porphyria. In that, one condition is acute intermittent porphyria. Okay, so in acute intermittent porphyria, because of this porphyrin deposition, what happened, there will be the heme will not be producing properly. Heme, okay, heme is the part of the hemoglobin, okay, which is essential for the RBC. Okay, so the heme production will not be happening properly. Okay, because of that, this porphyrin is getting accumulated. So because of that, it results in one enzyme deficiency that is called as porphobilinogen deaminase. Porphobilinogen deaminase enzyme deficiency. Because of that, heme production will not be happening. Okay, and because of that, proper hemoglobin will not be happening, so it results in the anemia. So such type of conditions will be generating. Okay, so the most frequent symptom of acute intermittent porphyria is this painful constipation, tachycardia. Okay, these are the main two symptoms of the acute intermittent porphyria. So here the answer is acute intermittent porphyria for the painful constipation. Okay, so if you liked this video, please like, share and subscribe. So in whenever you can turn on the notification button also. So whenever I'm adding in new videos, you can get the notification. So the next video will be starting tomorrow.